All right, good afternoon. This is Professor Bubba with EDSC 541. This is week 6, and this is the instructor video for week 6. So during week 6, you have your assignment 3 that is due this week on Sunday. You are selecting a character from either a book or a movie, and you are going to write a 3 to 4 page paper, including a brief description of that character or a younger version of that character. You're going to describe the symptoms and behaviors and tendencies and level of functioning and ways that this character relates to other people and manages his or her impulsivity and affect. You're going to use the theoretical frameworks to describe the controlling fears, beliefs, expectations, defense mechanisms, and object relations. And you're going to also include, which is very important, a description of how you would intervene with this person as his or her school counselor, and how you would imagine engaging in, how they would engage in treatment with you. Please remember to use your APA format and citations as well as references. In this week, we studied chapters 11 and 12. 11 was descriptive, impulsive control and conduct disorder and eating disorders, okay? So when talking about impulse control and conduct disorders, the two externalizing disorders that are most common are oppositional defiance disorder, ODD, and conduct disorder. So ODD has recurrent patterns of negative, defiant, disobedient, and hostile behavior towards authority and other figures that persists for at least 6 months. There are 3 types: angry, irritable mood. There's argumentative, defiant behavior, and vindictiveness. Okay, so those are the 3 subtypes. The risks include family discord, socioeconomic disadvantage, parental antisocial behavior. With conduct disorder, it is persistent, repetitive. It's a repetitive violation of rules and disregard for the rights of others. Its variability in its clinical presentation, and it usually is comorbid with other disorders such as substance abuse, oppositional defiance disorder. This is some possible biological factors, personal pathologies, family patterns, and peer relationships are possible causes of oppositional defiance disorder, as well as conduct disorders. Some effective treatments is a cohesive family model and behavioral techniques, and some ineffective treatments are punitive treatments. So there's also elimination disorder, which is urinesis and encopresis, and that's another disorder. A single outstanding symptom rather than a pervasive maladaptive pattern is prevalent with this disorder. With urinesis, it's bedwetting that's not organically caused. It has a variety of causes: faculty learning, immaturity, disturbed family, stress, and some treatments consider conditional procedures and drugs. Encopresis is the inappropriate toileting for bowel movements after the age of 4. It often is comorbid with uresis, and it's more common in boys, and a treatment is medical and psychological. So with these neurological disorders, there is a group of conditions that are characterized by an early onset and persistent courses that are believed to be the result of disruptions to the normal brain development. So if the onset is during, the onset could be during the childhood, or it could persist into adulthood. Attention deficit disorder is also with hyperactivity. This is a persistent pattern of difficulty sustaining attention and or impulsivity or excessive or exaggerated motor activity. The characteristics found often with ADHD are impulsive, overactive behavior that interferes with the ability to accomplish tasks. Sometimes they can have lower IQ, but with this disorder, there is 70% of the students are gifted and talented. Only 30% of the students or people with ADHD have also a learning disability or a low IQ. It also has social impairment, and there is a higher rate of this in boys. Some ADHD causal factors, definitely is hereditary. It's 90% hereditary. There are social environmental events. Sometimes a smaller brain or a slower brain development is also a causal factor of ADHD disorder. Some treatments, medication. Many people feel that medication is important depending on the type of ADHD that an individual has. For some, without medication, it's almost impossible for them to have a normal life. Other treatments, behavioral therapy is very positive in helping with ADHD, as well as family therapy. Autism. This is the autism spectrum disorder. It is a wide range of problematic behaviors with social deficits, the absence of speech, self-stimulation with repetitive movements, and preoccupation with managing sameness. Some causal factors, it's not really known to this day. There are some genetic risks, hundreds of genes associated with an increased risk. It could be hereditary, and it also could have mutations in the genes pool. Treatments for autism spectrum disorder. Behavior of autism children are not normalized through treatments. Newer instruction and behavior modification techniques happen to reduce some of the symptoms that we see in our autistic-like children. We have the tic disorder. Tic disorder is persistent, intermittent muscle twitches and spasms, usually limited to a localized muscle group. It has incidental levels. One is Tourette's disorder. It is extreme tic disorder involving multiple motor and vocal patterns. And then we also have specific learning disorder. So specific learning disorder is one of the disorders that our school psychologists are capable of assessing and diagnosing. So this is a delay in cognitive development in the areas of language, speech, mathematical, or motor skills that are not necessarily due to any demonstrable physical or neurological deficit. So these learning disorders are diagnosed by a clearly impairment in school performance or daily living activities, and the impairment may not be due to intellectual disabilities or persuasive development disorder. Dyslexia is another learning disability. It is problems in word recognition and reading comprehension. Some causes of learning disorders possibly are subtle to the central nervous system impairments, and genetic transmission is also a hypothesis. Intellectually disabled. These are deficits in general mental abilities, such as reasoning, problem solving, planning, abstract thinking, judgments, academic learning, and learning from experience. Intellectual intelligence and level of performance, and its onset is prior to the age of 18. So the levels of intellectual disability, It is mild intellectual disability, then moderate, and then severe, and then profound. Those are the levels. Some causal factors of intellectual disability: genetic, chromosomal factors, infection, toxin agents, trauma, ionizing radiation, malnutrition, and other biological factors. Some organic intellectual disability syndromes: Down syndrome, cranial anomalies, and some treatments. They don't have any, some methods they've used in the past are in institutionalization and education and inclusion programming, which is what we use. Special factors associated with treatment of children and adolescents: the child's inability to seek assistance, vulnerabilities that place children at risk, needing for treatment, treating parents as well as the children, using parents as a changing agent, problems with placement outside of the family, and intervening before the problem becomes acute. Okay. There are several child advocacy programs that fight for the rights of students with intellectual disabilities. And so that covers the important impulse disorders that the book covers. So some of the chapter 12, eating disorders. Some of the most common eating disorders are anorexia nervosa and bulimia nervosa. Both are intense and pathological fears of becoming overweight and fat, and the pursuit of thinness that is relentless and sometimes deadly. With anorexia nervosa, the characteristics: fear of gaining weight, refusal of maintaining normal weight. There are types: the restrictive type and the binge eating purge type. Bulimia, the characteristics are frequent episodes of binge eating, lack of control over eating, and recurrent inappropriate behavior. So with bulimia nervosa, you restrict the eating, it's motivated by the desire to be thin. Then the binge eating or restricting foods comes on, then vomiting, excessive exercise, laxative use, and then repeat. So it's a cycle for bulimia nervosa. With the binge eating, some characteristics are frequent episodes of binge eating, typically overweight or obese, non-compensatory weight loss behaviors. So the age and onset and gender differences of these two. With anorexia nervosa, it's most likely to develop 16 to 20-year-olds. Bulimia is most likely to develop in women ages 21 to 24. Binge eating disorder is most likely to develop in 30 to 50-year-olds. For every three females, for every one male, there are 3 females with an eating disorder, and gay and bisexual men have a higher rate than heterosexual men. So the prevalence of eating disorders: binge eating disorder is around 3.5% in women and 2% in men. The prevalence of BED in obese people is 6.5 to 8%. And the lifetime prevalence of anorexia nervosa is around 0.9 in women and 0.3% in men. The lifetime prevalence of bulimia is around 1.5 in women and 0.5 in men. Some medical complications that appear with eating disorders: anorexia can lead to death from heart arrhythmias, kidney damage, and renal failure. Bulimia can lead to electrolyte imbalancing, low potassium, and damage to heart, hand, throats, and teeth. So suicide risk is high amongst those with anorexia. Long-term prognosis for bulimia is relatively good compared to anorexia nervosa, and high rates of clinical remission for binge eating disorder is possible. For anorexia after 21, the age of 21, 51 fully recover. 51% of people fully recover. 21 partially recover. 10 do not recover, and 16 no longer are around. And those are percentages of those who have suffered from anorexia nervosa after the age of 21. Bulimia, 70% go into remission after the ages of 11 and 12. And binge eating, 60% go into remission after 6 years. So people with eating disorders often later develop other eating disorders. So bi-directional transition between two subtypes of anorexia. It shifts from anorexia to bulimia. There's few transitions from bulimia to anorexia. There is no shift from restricting anorexia to bulimia. And there's no shift from binge eating to anorexia nervosa or vice versa. So eating disorders associated with other following disorders. So the eating disorders lead to clinical depression, obsessive compulsive disorder, substance abuse disorder, and a variety of various personality disorders. Eating disorders across cultures. Eating disorders become a problem worldwide. Attitudes that lead to eating disorders are more common in whites and Asians and African Americans, and some clinical features may vary according to other cultures. Eating disorders are multi-determined with biological factors, social factors, family influences, individual risk factors. The biological factors are hereditary tendencies, brain abnormalities, the set point theory, and serotonin. The social cultural factors, media related, idealized extreme thinness, female internalized ideas, and Western values towards thinness. The family influences are the individual risk factors, gender, age, sexual orientation, internalization of thin ideas, perfectionism, negative body images, dieting, negative emotionality, and childhood sexual abuse. Some treatments for eating disorders, it can be very challenging and it has to have a hospital commitment. Treatments for anorexia nervosa, some common ones are emergency procedures to restore weight, antidepressants or other medications, family therapy, and cognitive behavioral therapy. Treatments for bulimia nervosa, antidepressants, and other medications, and cognitive behavioral therapy. Treatments for binge eating disorder, medications, antidepressants, appetite suppressants, interpersonal psychotherapy, cognitive behavioral, and interpersonal therapy. So problems with obesity. Obesity is the state of excessive or chronic fat storage and a major wide world health problem. More than 1.9 billion are overweight, with 60 million that are obese. Medical issues that come from obesity: high cholesterol, hypertension, heart disease, arthritis, diabetes, and cancer. Demographic factors are of sex, race, ethnicity, and socioeconomic status. So it's defined by your body mass weight index, which is your BMI. Obesity is a BMI with above 30, right? So Risk factors that cause obesity: genetic inheritance, hormones, sociocultural influences, family influences, stress, and comfort eating. The roles that the genes play, that genes that are predispose a person to gain weight quickly were once advantageous, and thinness runs in the family. Genetic mutation is associated with binge eating. The hormones that help us regulate the appetite are leptin and ghrelin. Some social cultural influences with obesity: time, pressure, restaurant portions, ultra processed foods, food accessibility, advertising, and immigration to the US. Some family influences: high fat, high caloric diets, eating to alleviate distress or show love, overfeeding, socially contagious obesity. Stress and comfort foods include eating when under stress, higher in fats and carbohydrates, pleasurable, and they help to reduce tension. Some stimuli that or conditions that are perfect for stress eating and comfort food: watching TV, watching movies, attending parties, becoming anxious or angry or bored. So the pathways to obesity: low self-esteem, then to binge eating, social pressure to conform to thin ideas, depression, and then low self-esteem. It's cyclical. So the treatment for obesity: lifestyle modifications, medications, and bariatric surgery. So the importance of the prevention is 3 simple steps: eat 3 fewer bites of food at a meal, walk or take the stairs more often, and sleep more. All right, so those are the two the important parts of chapters 11 and 12 for this week. If you have any questions, I'll be posting additional information, and we'll have a case study for us to work on week 7, and you'll also do a brief discussion, 2 to 3 minutes on your case study. Look forward to seeing you week 7. Thank you.